Children's Clinic. Children's Clinic, like you know, is a program that takes care of the children. We take a critical look at the health issues affecting children. So today, again, as usual, on the show, we will be doing justice to that. My name is Jumoke Adiswa. Welcome. And on today's edition of Children's Clinic, we're taking a look at children's oral care. What do we mean by children's oral care? Well, this is a situation where you mind everything about the oral care of the child, talking about the teeth, care of the teeth, the setting of the teeth, and dentition, and all what have you, as related to child oral care. So today we'll be taking a look at that. We have a doctor on the show who will be taking time to explain what it is to us to mind the oral care of our kiddies. Also, we have a package that will teach your child how to brush properly. You know, children can be very, very funny when you talk about brushing. You know how naughty they can be. At times you tell them to brush, you find them running away, not wanting to, or better still, when you have the paste on the brushes, you know, sometimes they prefer to lick than actually brush. Well, today on the show, we'll be teaching them how to actually brush and how to encourage them to brush. Away from that also, we'll be talking about the child's first visit to the dentist. How often do you visit the dentist? Is it even necessary to visit the dentist? When should your child visit the dentist? Well, these are some of the things we'll be taking a look on the show today. Stay tuned. We'll be right back after this break. Don't go away. Welcome back. The program is Children's Clinic, and right now we're having our doctor on the show. We'll be talking to us about World Oral Health Oral Day. Well, it was celebrated some times ago, and it also is an avenue to create the necessary education about our oral care. So stay tuned now as we bring Dr. Olurotimi Olojede of the Lagos State University Teaching Hospital, Idi Araba, as it takes us on that.
The World Oral Health Day is the day set aside to be observed by all nationalities that are represented in the World Governing Body of the Dental Profession. We call it FDI, World Federal Dental International. It's based in Switzerland. That was where the decision was made. And initially it was being celebrated in September 12th of every year. But due to reason best known to the governing body, it was changed to March. About 3-4 years ago, it was changed to March 20th of every year. And basically what we do to wait until there is pain or a particular complaint. So basically what we do is to create dental awareness. Well, talking about World Oral Health, it's also very, very important for us to observe that day because we realize that the awareness is quite low. And talking about Sahara, we want to see that taking care of our teeth has not been our habit, which has really made a lot to lose their teeth even at a very early or premature age. You can imagine an individual before the age of 40, mid-30s, they have less than 20 teeth in their mouth. It's very, very important to follow some pertinent steps which will help one to keep good oral health status, which indeed will be neglected or abandoned in this part of the world. For children, I think it's important to even start at a very, very early age because as one ages and you neglect your oral health hygiene, you discover that you tend to lose those teeth or one form of problem or challenges do come in. So talking about in children, as long, what we could say is the moment a child starts to erupt that teeth, following the developmental milestone of children, by age 6 months at least, the first one will come out there on the lower jaw. One, the first male teeth, second one, the incisors, the lateral, the central. You start to take care of the children's teeth. And what we basically do, now we have the children's toothbrushes. We also have toothpaste adapted for children. Even if you don't have that, the toothbrushes for children, then you have your normal toothpaste. What we use is the peanut size, a very small size, because we find it difficult for them to spit out. They tend to take it in because it's sweet. So but for a peanut size you use to brush the baby's mouth is not too much. Even if the individual swallows that, that wouldn't be deleterious or cause any harm for our children. So peanut size, and we assist our children. Don't just leave them. Please, you are still a child. What do you want to do with your teeth? You just give them the brush and give them the toothpaste. No, you want to supervise them and help them to brush their teeth. And you know, talking about brushes, not just decorating the mouth with the toothbrush or the paste, but rather to make sure that they use the brush to really go down the corners of their mouth and wash those 20 teeth that is prevalent in the mouth of a child. By age 2.5 or to 3 years, you have 20 teeth in that child's mouth, and it should be properly taken care of. The reason, number one, it's important so that those teeth will last for the period they ought to be for the milk teeth, and much more than that. Those milk teeth, those children's teeth, tend to help to guide the permanent one when they want to erupt. And if you've lost them prematurely, of course, such a one will have scattered or haphazard developed adults. For infants, well, some form the habit of using foam. I can still say we have soft brushes, even as young as a child, 6 months of upward from 6 months. There are toothbrushes for them. And also tend to just clean the tongue. Also very, very important. You clean the tongue. And much more than that, taking care of infants' teeth. Please don't say, oh, they are quite young, this small child. No, every six months, still present your child to a qualified dentist. At most, what would you do? You examine your child and tell you, oh, for the next 6 months, for the next 1 year, the child has a clean slate of oral health issues or challenges. We will see you in the next 6 months, we'll see you in the next 1 year, and for that you'll be sure. And the moment you have your child gives any complaint, don't ignore it. Oh, you are a child, what do you know, or what is happening to your mouth? No, please present that complaint in the 4 walls of a dental clinic, and I believe the child will be okay. Okay, mouth ulcers, well, has nothing to really do with age. The important thing is what's the cause of that mouth ulcer. So I wouldn't want to encourage unorthodox treatment, or perhaps the mother just thinking, or the parent that they can handle it just on their own. Number one, you want to discover an ulcer in the mouth of your child. Well, there are basic things you can do. Warm saline mouth baths. Get warm water, not hot water. Warm water. Add just a little salt to it, and you allow the child to gargle with that. And definitely it might be painful, so you give some pain relief medication, perhaps any of those painkillers or pain relief medications that we have. It could be syrup, depending on the age of the patient. It could be syrup form or in tablet form, if the child can take the tablet form, the recommended dosage. But I haven't done that after 1 week or thereabouts and the ulcer is not subsiding. Please don't keep or harbor that child. You present to a dentist, and by the time you get to the general dental practice, or we call them family dental physician, they look into it. If they feel that you need to see the patient need to see a specialist, there are specialists who deals with mouth ulcer. We call them oral medicine specialists. So the doctor at that point in time will give you a referral, or will invite an oral medicine specialist into his clinic for them to take care of that ulcer. Basically, in summary, what I'm trying to say is that don't hold on to self-medication for a long time before it degenerates. Present at the 4 walls of a dental clinic, and if it's still lingering, the ulcer is not getting closed up or getting healed, I'm telling you, any ulcer that is there for more than 2 weeks, please don't joke with it. It could be sinister. It could be the form of developing cancer. So it's important you see a specialist or see the dentist to take care of the ulcer. The role of the parent is for them to quickly identify the fact that there's a challenge in that child's mouth. And the challenge they present in different forms. But what we have discovered as clinicians over the years is that because of the level of poverty or financial handicap around this part of the world, we tend to neglect the oral health complaint of our children, and we tend to just pacify them because we think of our pocket, we think of the money that's going to get involved, and for that, if the child is not really complaining of a severe or serious pain that disturbs their sleep, we tend to just quieten them that, well, don't worry, it will go. But sometimes you see parents that are really concerned, even derangement of the teeth not even erupting appropriately. You see them coming to the clinic complaining. So the role is of parents is quite clear in that they shouldn't ignore the complaint. If the patient is not complaining, as a parent, you need to look into your mouth of your word or your child as regular as possible. Even sometimes when the child is communicating, talking to you, oh, what's happening to your mouth? You look into that, and by the time you discover things that are not really normal, don't think they will normalize or they will normalize themselves or itself. No, you want to take that child and present it to a qualified dentist. Most of the primary health centers have at least a dental clinic with a dental nurse and attendant, even not a dentist. So the role, number one, is for the parent to identify the challenge, then take the the child to a dentist. And the role of the dentist is quite clear. For a qualified dentist, you don't need to tell him or her what to do. Definitely, you examine the patient, you arrive at a definitive diagnosis, and from there, you take a definitive treatment plan to take care of those challenges or the complaint that the patient comes with. So with that, we have an interwoven relationship. As by the parent presenting, because to be difficult unless by accidental discovery, maybe the child walks towards a dentist or we have cause to come in contact with that individual. I will now send the person to the parent. It is primary, it is important, it is fundamental that is the parents that will discover the problem and eventually present in the 4 walls of the clinic, and the dentist will perform his or her role by attending to that challenge that is being presented to him or her. That occurs every now and then. When you have that, just get a clean handkerchief, or in every home, I want to believe that always a cotton wool. Get cotton wool, wash your hand very well with a clean hand, since it's your child, it's not a third party. So clean your hand very well, get a cotton wool, just apply pressure on that particular cut. It will definitely stop. And then in doing that, as I've said, you can now just make warm water and salt for the child to gargle with, and then give some form of pain killer or pain relief medication. Under 2-3 days, naturally everything will heal. My candid advice to every parent is that please don't ignore the oral health of your children. It's better you present them, you cultivate the habit of making them to know that it's quite important for them to take good care of their mouth. I'm talking about their mouth, everything within that oral cavity, both their teeth and also their gum, in that they should form a good brushing habit, to brush in the morning and the last thing before they go to bed. They shouldn't involve in lifestyle that will endanger their mouth, running without protecting their mouth, just falling and not protecting their mouth. All this will make them to lose especially the teeth in front prematurely. The way they guide their eyes, they guide their nose and other part of their body, they should also guide their mouth, because an individual will develop our self-esteem even from our teeth. If my teeth is not well set, if my teeth is not white enough, if my mouth is smelling, definitely I won't be able to talk in the society, I won't be able to talk in in an open place. I will want to keep to myself, because I believe I have this challenge and there's no way I could present myself to the larger world. So as parents, let them cultivate that culture from the beginning of life, that is important for them to take good care of their mouth, washing their mouth, and also you exposing them by taking them to dentists at a regular interval. By the time they develop or grow up with this, even when they become adults, I'm so convinced, so sure that they will be able to take good care of their oral hygiene.
I am sure that you have learned a lot. I have learned a lot. I now know that to mind blood clots, you can just press on the spot that is oozing out blood, and before you know it, it will stop. I'm sure that you also know now that it is very, very important to visit the dentist. And it is not only when you have issues with your mouth or your teeth that you visit the dentist. And I also know that you visit your dentist at least once in 6 months. Well, that was Dr. Olurotimi Olojede. Hope you enjoyed that interview. We're moving on the show now as we take yet another package on how or when your child's first visit to the dentist.
Your child's first dental visit. 5 things you can do to make it a success. Tips for preparing your child's first dental visit and each visit after. Do you have tots with tiny teeth in your home? Or are you expecting soon? Are you a teacher or caregiver for babies, toddlers or preschoolers or parents? Here are 5 great tips to help those little ones learn to love taking care of their teeth and have a great experience at dental checkup visits. First tooth or first birthday, first dental checkup visit. Are you wondering when your child's first dental visit should be? You're not alone. We get that question very often. Those early months and years for babies and toddlers are filled with first. The best time to start taking kids for dental checkups is either when their first tooth erupts or right around their first birthday. While some pediatricians do a basic check in the mouth, not all do, and dentists are trained to immediately identify any potential issues with the growth and development of the jaw and soft palate. Baby teeth are more porous and susceptible to decay than adult teeth, so early intervention is critical to help ensure those tiny teeth stay healthy. If your child is a little bit older and hasn't yet had their first dental visit, it's never too late. Bring them in as soon as you can. We also recommend that parents start brushing their child's teeth as soon as they start coming in, using a soft, bristled, or baby-safe toothbrush and plain water. The easiest way to create healthy, lasting tooth brushing habits is to start early and be consistent. It's never too soon to start introducing children to tooth brushing and oral health. The best time to start and get started is before your child's first dental visit. Children love to learn about their bodies and love to smile, touch, and explore new things. Many parents and caregivers love to teach children to point to their own eyes, nose, belly button. Why not add teeth and tongue to that list? There are also a variety of baby and child-friendly books, crafts, activities, songs, and even apps that can help teach little ones about teeth, toothbrushing, dentist, and healthy smiles. The more comfortable they are with their mouth and teeth, the easier your child's first dental visit will be. Number 3, practice makes perfect. Tooth brushing is an important part of our daily self-care and grooming habits. And just like other habits, babies and toddlers learn as they become more independent. A great way to introduce little ones to tooth brushing is to make it a group activity. Parents and siblings can brush their teeth together with little ones. It is very important to note that though the toothbrushes are tools, not toys, and that babies and toddlers should be closely supervised. There are all kinds of songs for routine like washing our hands and picking up our toys. Number 4, attitude matters. Babies and toddlers, just like older children, are very perceptive and sensitive to the attitudes and energy of those around them. Children often mirror our behavior. When we are relaxed and happy, children are more likely to be relaxed too. Children are also more relaxed when they are prepared. Spend time talking to children, yes, even babies and toddlers, about visiting the dentist. Other siblings can also help in this area to serve as a good role model and to talk in a positive way about visiting the dentist for a checkup. You can bring your little one to dental visits to get them used to the sight and sounds of a dental office and to help them prepare for their own visit. Number 5, choose a great dental office that you trust. The The best way to ensure a positive experience is for you to have a positive experience too. That's why it's so important to select a dental office and provider that you trust and feel comfortable with. Here are a few factors to consider, especially when selecting a great dentist and dental clinic for your child. First of all, it has to be conveniently located near your home, school, or work. Flexible appointment is a necessity. We're all busy, and it helps when you can find early morning, evening, and even weekend appointment times that fit your schedule, including family appointments. Caring, compassionate, experienced staff and doctors are also a necessity. Dentists, hygienists, and staff should not only have experience in pediatric dental techniques and services, but they also should love what they do, and it should show at all times. Kid-friendly facilities. Dental checkups don't have to be scary. They can be fun. Child-oriented dental exam rooms, as well as positive behavioral reinforcement techniques and post-visit rewards are all great ways to help ensure that each office visit is a great success.
Yes, you have seen that. I'm sure that you now know that it is very, very important to take your child on a visit to the dentist, and you should do that just at worst once in 6 months. And when you notice any changes or any issue on your child's mouth, the first place to go is to go to the dentist, and don't self-medicate. Also, you know now that visiting the dentist will straighten a lot of issues, and you as a parent or a ward should always monitor your child's mouth to know when there are issues. You have to consult a specialist. Well, the program is still Children's Clinic, in case you're just joining us. It is a children's health magazine program where we take a critical look at issues relating to children's health. So again, we continue on the program. We have a package that will teach your child how to brush. Stay tuned and be part of it.
Hi, Danny. What are you doing?
I'm brushing my teeth.
Oh, okay. What's that?
You know, it's when you put toothpaste on a toothbrush and you brush your teeth. Have you ever brushed before?
Sure I have. See?
It looks like you need to floss.
Really? What is floss?
I know just the right person that can help you. Come with me.
Everybody brush your teeth, brush your teeth. Everybody brush your teeth. Circle, 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 circle. Everybody brush your teeth, brush your teeth. Brush, brush, brush.
Everybody brush your teeth. You have to get rid of those cavity creeps. Brushing, let's brush some more. How many times a day? 4. Get toothpaste and a toothbrush. Put them together and then you brush. Little circles and not too fast. Let's keep it moving and make it last.
Everybody brush your tongue, brush your tongue. Everybody brush your tongue. Everybody brush your tongue, brush your tongue. Brush, brush, brush.
Everybody brush your tongue. Those cavity creeps are on the run. Up and down, you can't stop now. Brush your tongue, I'll show you how. Back and forth and side to side. Take your toothbrush for a ride. Sweep in the front and in the back. Now rinse it out, that was a snap.
Everybody floss your teeth, floss your teeth. Floss, floss, floss.
Well, we've heard that. I'm sure that now you know how to lure or encourage or make your children want to brush. Well, you see there that we can also do that as a group to encourage the child to learn how to brush. Well, we're taking yet another break, and then when we come back, we'll be signing off with the show. But before then, we have these facts on dental health. Well, thank you for being a part of the show. Today we'll be wrapping it up on Children's Clinic today. And don't forget that again next week we'll be back on the show. Today we took a critical look at oral health care of the child. I'm sure that you have learned a lot. I have learned a lot, and I'm sure you've also learned a lot on the show. So join us again next week as we come with yet another topic that will be of interest to you and your family. Until then, my name is Olojede. So do have a great week ahead. Bye-bye.